Assalamualaikum. Beta, in this video lecture, I will continue the lecture on chromosomal abnormalities. In the previous part of this video lecture, I delivered you all the basic concepts, the karyotyping and the chromosomal abnormalities, the deletions, the additions, the translocations, and all about the detailed explanation on the aneuploidy. Okay, so starting with the chromosomal abnormalities, it can involve the autosomal chromosomes and can involve the sex chromosomes as well. Okay, so starting with the chromosomal abnormalities that involve the autosomes, a very good example is of the trisomy 21. Trisomy 21, that is the Down syndrome beta. Okay, if let's suppose this is the 21st pair of your chromosome, this is 21st pair of your chromosome. If on this 21st pair of chromosome there is one extra chromosome, if there is one extra chromosome present on the 21st pair, it is called trisomy 21 and it leads to Down syndrome. Okay, by the way, Down syndrome is the most common chromosomal abnormality and it is the major cause of the intellectual disability, that is the low IQ. Okay, and 95% of the affected individuals have trisomy 21. So their chromosome count should be obviously 47, क्योंकि एक क्रोमोसोम ज़्यादा है तो 46 के बजाय 47 हो जाएंगे. ठीक है, and the one chromosome that is added here on the chromosome number 21, it may show Robertsonian translocation. Robertsonian translocation of the long arm of the chromosome number 21 to another acrocentric chromosome, for example on the 22nd pair, or with the chromosome on 14 with the 14th pair. Okay, so what do I mean by this beta? That so far you are clear that what is Down syndrome. It is the trisomy 21, that is one chromosome extra present on the 21st pair, and this Down syndrome is the major cause of the low IQ, that is intellectual disability, and 95% of the people show this, that is one extra chromosome present on the 21st pair. अच्छा, ये जो 21st पे एक एक्स्ट्रा क्रोमोसोम ऐड हुआ है बेटा, इसकी जो लॉन्ग आर्म है, दिस लॉन्ग आर्म, इट कैन शो रॉबर्टसोनियन ट्रांसलोकेशन. अब ये रॉबर्टसोनियन ट्रांसलोकेशन क्या होती है बेटा? ये एक्रोसेंट्रिक क्रोमोसोम्स में होती है, एंड आई हैव डिलीवर्ड अबाउट दिस इन अ डिटेल्ड एक्सप्लेनेशन इन द part 1 of the video, so go check it out beta. Okay, so the genes on this 21st chromosome can be translocated with the genes on the chromosome 22nd pair or with the chromosome on 14th pair. Okay, yeah, look, 22 or 14. About approximately 1% of the patients are mosaics, that means having a mixture of the cells with the 46 or the 47 chromosomes. Okay, if let's suppose this is the individual, if this is the individual, no drawing can be worse than this in the world, but still you can understand this. This is, if this is the individual who is developing the Down syndrome, so if I take out one cell outside, you will see that on the 21st pair of chromosomes there will be one extra chromosome. This is what you have learned so far. But what does this mosaic mean? Mosaic means that the few cells carry this trisomy 21 and the remaining cells are normal. That means the remaining cell, if I take out one more cell, then you will see there are only two, I mean one pair present on the 21st. Okay, no extra chromosome. So this is the mosaic. By the way, I have explained this mosaicism in the previous part of the video as well. Okay, so in short, what is mosaic? That the few cells showing trisomy 21, that is one extra chromosome, 47 instead of 46, and few cells are normal having 46 number. Okay, are you clear with this? Right. Now let's talk about some features of the Down syndrome. If you develop the Down syndrome, how will you present? The typical important features, let me show you by the picture. You can see here some very important features beta. Very important features. Starting from here, there are the slanted eyes, तिरछी आंखें, सीधी होने के बजाय there is the up fold, एपिकेंथियल फोल्ड प्रोमिनेंट हो जाता है और ये slanted eyes हो जाती हैं. यूं होने के बजाय कुछ यूं हो जाती हैं, slanted eyes. Okay, and you can see the nasal bridge is very much flat. There is no ridge. The bridge is flat. Okay, and one very important feature that the ears are folded and they are little lower. Okay, and the neck becomes very much short. Even you can't see you can't see the neck in this picture because it is very much short. These are some important features of the Down syndrome, beta. Okay, yeah. Few more features you can see from here, that obviously there is intellectual disability. The IQ is very much low, and another very important feature is the simian crease. What is this simian crease? The simian crease refers to a very straight crease on the palm. Very straight crease. Normally, if you see anybody having, let's suppose you can see on this, if this crease becomes very much like this, very much straight, this is said to be the simian crease, which is seen in case of Down syndrome. This is the picture of Down syndrome. IQ is very much low. There are slanted eyes. You can see almond like slanted eyes. Neck is very much short. Ears are little lower. Crease is simian, that is very much straight. There will be CHDs, congenital heart defects, ASD and VSD. And there may be the intestinal stenosis or umbilical hernia as well. Okay, and a very important feature is gap between the first and second toe. There should not be that much gap. There should not be that much gap between first and second toe. But in case of Down syndrome, there is big gap between first and second toe. I hope you are clear with this, beta. After Down syndrome, let's come to another autosomal chromosomal abnormality, that is the Edwards syndrome. What is this Edwards syndrome, beta? It's not really common. Its incidence is 1 in 8,000 बर्थ्स. अगर 8,000 बच्चे पैदा होते हैं तो बेटा उसमें से एक बच्चे को एडवर्ड सिंड्रोम होगा. इट इज़ ट्राइसोमी 18. ओके, ट्राइसोमी 18, दैट मीन्स अगर ये आपका क्रोमोसोम नंबर 18 का पेयर है तो उस पर एक एक्स्ट्रा क्रोमोसोम आ जाए. ये नॉर्मल पेयर था, उस पर एक एक्स्ट्रा क्रोमोसोम आ गया. ठीक है बेटा. इस केस में भी मोसिसिज्म देखने को मिल सकता है कि मतलब अगर आपकी बॉडी में 100 सेल्स हैं टोटल, लेट सपोज उसके अंदर 50 जो सेल्स हैं उसके अंदर ये ट्राइसोमी हो और 50 सेल्स जो हो नॉर्मल हो, इसको हम क्या कहते हैं? मोसिसिज्म. इसको हम क्या कहते हैं बेटा? मोसिसिज्म. कि जो 50 सेल्स हैं उसके अंदर ट्राइसोमी है क्रोमोसोम नंबर 18 पे, 2 के बजाय 3 क्रोमोसोम मौजूद हैं, बाकी जो है नॉर्मल हैं. सो 50 cells will be 47 chromosomes and 50 cells will be showing normal 46 chromosomes. Okay, some very important features of beta Edwards syndrome. Let's follow from the picture first. You can see here that a very important feature is the prominent occiput. You will see everywhere. The occiput is, this occipital protuberance is very much prominent, and the ears are little lower, just like the Down syndrome, and the jaw is very much small, that is called microgenetia. Heart defects, congenital heart abnormalities, just like the Down syndrome. Okay, and a very important feature is the clenched hand. कुछ इस तरीके से बंद, clenched hand, and there is overlapping of the fingers. You can see overlapping of the fingers and the hand is clenched. Okay, yeah. So even you can follow the same features from this picture as well. I'm like not really good picture to understand, but still you can get some points. Prominent occiput, intellectual disability, microgenetia, that is the lower jaw is very much small. Okay, and there is overlapping of fingers and the hand is clenched. There are some congenital heart defects, renal abnormalities, and a very important feature is down there, that is the rocker bottom feet. Okay, unlike Down syndrome, there is no gap between two toes. Okay, so make sure this is okay, this is the microgenetia, beta. You can see the jaw is very much small. This is microgenetia in Edwards syndrome. And one more thing that I have to show you is what is this rocker bottom feet. The feet is twisted, beta. Let me show you the twisted feet, twisted foot. In case of Edwards syndrome, you can see this. This is the twisted foot. This is the twisted foot. It's a very important characteristic feature. Okay, yeah. So Edwards syndrome. After this Edwards syndrome, let's go a little ahead to the Patau syndrome. Patau syndrome is also a chromosomal abnormality. It is a trisomy 13. What happens in trisomy 13? That normally on your chromosome number 13, there is a pair of chromosomes at number 13. Is a 13th pair. But if what happens, there is one extra chromosome, it is trisomy 13. Okay. In this case, by the way, this is even less common than Edward syndrome. Edward syndrome was one birth in 8,000. It is one birth in 15,000. Okay, 15,000 में से एक बच्चा ऐसा होगा जिसको पटाउ syndrome होगा. By the way, Patau syndrome, beta, this can also show mosaic variety. Again, the same thing. Few cells in your body shows trisomy 13 and few cells are normal. That means few cells are normal, 46 chromosomes, and few cells are showing 47 chromosomes, that is trisomy 13. This is called mosaic pattern. Okay. Some important features of the Patau syndrome, beta. Some important features of Patau syndrome. Like... Okay, there is microophthalmia, that the eyes are very much small. There is polydactyly, that the fingers are supranumerary, extra fingers, polydactyly. There is microophthalmia, that the eyes are small, and there is microcephaly, that the head is also small, and there is cleft lip and the cleft palate as well. I can show you from this picture. Can you see this is trisomy 13, where you can see there is microcephaly, that is small head, and the cleft palate and the cleft lip is present. Okay, and the eyes are also small, that is microophthalmia. Okay, and few more features just like the Down syndrome and Edward syndrome, that the cardiac defects CHDs are present. There is umbilical hernia and the renal defects as well. And also in case of the Patau syndrome, you will come to see the rocker bottom feet, that is the twisted feet. Okay, that was also present in the Edward syndrome, beta. So far what have we discussed? That the autosomal chromosomes से related जो chromosomal abnormalities हैं, उसमें मैंने बेटा आपको एक Down syndrome बताया. What was the number 2? It was Edward syndrome. And at number 3 was the Patau syndrome. Okay. Now comes the chromosomal abnormalities of the sex chromosomes. Abnormalities involving the sex chromosomes. And beta, let me tell you one very important thing. That the chromosomal abnormalities of the sex chromosomes are far more common and better tolerable as compared to the chromosomal abnormalities of the autosomes. Why this is so? Because you know what, beta, if we come to the last pair of chromosome, then in female it is XX, in case of male it is XY. Yeah, this is the female last pair, the sex chromosome, and this is the male last pair sex chromosome. Okay, just tell me, answer the question that does this chromosome carry any gene? No, this chromosome does not carry any gene. And in female, this chromosome, in not all the cases but few cases, this chromosome is lionized. This is lionized. That means it is inactivated and it does not carry any gene. So we are already programmed, or already have ability to tolerate the loss of genes from the sex chromosome. So this is the reason why the cytogenic disorders or the chromosomal abnormalities of the sex chromosomes is more common and more tolerable as compared to autosomal chromosomal abnormalities. Look here, the sex chromosomal abnormalities are far more common than those related to the autosomal abnormalities. Why? Because the imbalances, that is excess or loss of sex chromosome, are much better tolerated. Why? Because in female there may be lionization or inactivation of one chromosome, and in case of male there is modest amount of genetic material carried by the Y chromosome. Male में तो वैसे ही बेटा Y chromosome में genetic material नहीं होता, और फीमेल में एक बहुत सारे केसेस में लायोनाइज्ड होता है, इनएक्टिव होता है. So we are already adopted. We already have tolerance to not carry genes on this, to have some sort of chromosomal abnormalities. So sex chromosomal abnormalities are going to be more common and better tolerated. So let's now talk about the examples of sex chromosomal abnormalities. A very good example, beta. Before I tell you, you should tell me, beta. A very good example, and the common example is the Klinefelter syndrome. It is male hypogonadism. Normally, this is the male sex chromosome. But in case of Klinefelter syndrome, there is there is trisomy, that is it becomes XXY. तो बेटा X कंपोनेंट बढ़ गया, तो बताओ मेल में हाइपोगोनेडिज्म होगा, हाइपरगोनेडिज्म होगा? ऑब्वियसली देयर विल बी, क्योंकि X कंपोनेंट बढ़ गया ना, तो देयर विल बी मेल हाइपोगोनेडिज्म. ओके, देयर आर 2 X chromosomes and 1 Y chromosome. Okay, so what will be the clinical features? Let's talk about this. That actually there is aneuploidy and this is trisomy. Okay, because 1 chromosome is added, and obviously there is supranumerary X. This is a supranumerary extra X added. Okay, so there will be hypogonadism. Classically it is XXY in 90% cases, but in 15% cases there may be, you know, mosaic pattern. What does it mean? Look, in 90% individuals, what happens that all the cells in their body are having this condition. What is normal? In case of male, this is, look, normally there are 46 chromosomes and the last pair is XY. This is male, okay? And what happens in case of Klinefelter syndrome? That instead of 46 it becomes 47. 1 chromosome is added, and the last pair, which is 47th, it becomes XXY. Okay, in 90% cases of Klinefelter syndrome, what happens that all the cells carry this abnormality, but in 15% cases you may come to see mosaicism, that the few cells contain this abnormality and the few cells are normal, having their normal last pair. Okay, but remember, this is seen in case of 15% cases only. Yeah, this is the Klinefelter syndrome, beta. Male hypogonadism. Male hypogonadism. Even I can show you some features of the Klinefelter syndrome. Let me bring, yeah. You can see there will be feminization because 1 X chromosome is added, so there will be more feminization. And male hypogonadism. Okay, you can see there is a tall stature with the frontal baldness absent. This is more like feminization. Beard growth will be poor, so it is more like feminization. Okay, and there will be the breast development and osteoporosis. The testes will become small, that is referring to hypogonadism, and the pubic hairs will be like more in like female type fashion. Okay, and there will be tendency to lose the chest hairs. This is due to the hypogonadism. Beta. Okay, and now let's come to another sex chromosomal abnormality, that is the Turner syndrome. Turner syndrome, beta, Klinefelter syndrome was your trisomy. There was addition of the chromosome. Turner syndrome is monosomy. 1 chromosome will be lost, and it is the female hypogonadism. Normally what happens, this is the last sex chromosome ka pair in female, but in case of Turner syndrome there is this condition mostly, that only 1 chromosome is present and the second chromosome is lost. Okay, yeah. Okay, a very important thing is coming ahead, beta. A very important thing. 57% cases of Turner syndrome show missing an entire X chromosome, resulting in a 45 and the last chromosome having only 1 X chromosome. Okay, 1 is missing. But in remaining cases, what happens, that the 14% have structural abnormalities of the X chromosome, and 2/3, that are 29%, are mosaics. I can like, there must be some confusion, but let me make it clear. Look, if there are 100 people who develop Turner syndrome, so out of these 100, 57% जो लोग होंगे, उनके अंदर, बॉडी के अंदर जितने भी सेल हैं, सारे सेल्स के अंदर 45X0 हो जाएगा. दैट इज़ मोनोसोमी. इसको और आसान करके समझाते हैं बेटा. 57% लोगों में क्या होगा कि ये ना आगे, आपके नॉर्मली 46 क्रोमोसोम होते हैं, लेकिन ट्राइसोमी जो है बेटा, मोनोसोमी जो होगी टर्नर सिंड्रोम में, उसमें ये होगा कि आखिरी जो क्रोमोसोम है ना, अभी आप 45 अपनी जगह पे रखें और जो आखिरी क्रोमोसोम था XX, उसमें से एक डिलीट हो जाएगा X, तो ये हो जाएगा 45X0. ओके, दिस इज सीन इन केस ऑफ 57% केसेस. द रिमेनिंग 43% केसेस के अंदर हमने उसको दो हिस्सों में बेटा डिवाइड किया गया है. ओके, 14% हैविंग स्ट्रक्चरल एबनॉर्मेलिटीज ऑफ द एक्स क्रोमोसोम एंड 29% आर मोज़ेक्स. अच्छा, अब इसको ज़रा मैं और थोड़ा आसान करके बताता हूँ बेटा. देखें, ओके, 100 इंडिविजुअल्स आर देयर in okay, we are dividing 100 into 1 is the 57, another category of 14 individuals, another category of 29 individuals, that make up your 100. Okay, so in case of 57 individuals, there is complete, typical situation, that is normal 45 chromosomes, और आखिरी जो पेयर था उसमें एक क्रोमोसोम तो सही सलामत है, बाकी दूसरा डिलीट हो गया. ओके, क्लियर? In case of 14 individuals, what can happen is that there are the 45 normal chromosomes and there is 46th pair in which one chromosome is very much normal. Second chromosome is not completely absent, but it is present, but having a structural abnormality. Okay? And in 29% individuals, what happens? This is complete different thing. That these 29 people, they can show two situations. Okay, one is that they have normal 45 chromosomes and last pair is having one normal chromosome and one chromosome is completely absent. Okay, and there may be the condition that they have normal 45 chromosomes and remaining last pair is also normal. So जो लास्ट के जो 29 इंडिविजुअल्स हैं, हर इंडिविजुअल के अंदर कुछ सेल्स जो हैं वो एबनॉर्मलिटी शो करेंगे और कुछ सेल्स नॉर्मल होंगे. सो दीज 3 सिनेरियोज कैन बेटा बी कंसिडर्ड. ओके, या नाउ सम फीचर्स ऑफ बेटा टर्नर सिंड्रोम, that is female hypogonadism. Yeah, let me show you beta. There we go with the Turner syndrome. There is short stature, by the way, short stature, and there is kind of low hairline, shield shaped thorax, and the very important feature, by the way, of all these is the widely spaced nipples. Okay, widely spaced nipples. And let's come to very important feature, another, that is the rudimentary ovaries. Okay, because this is a female hypogonadism, so how the ovaries are going to be normal? So ovaries will be rudimentary. Okay, underdeveloped gonadal structure, and there will be no menstruation because of hypogonadism. Okay, and there will be obviously poor breast development, and these are some special typical features that you need to keep in your mind regarding Turner syndrome beta. Okay, now we are done with the autosomal chromosomal abnormalities and the sex chromosomal abnormalities as well. Few terms are left beta. Let's get done with that very quickly. What is genomic imprinting? Genomic imprinting is the normal procedure. It is the epigenetic process in which what happens that there is inactivation of either the maternal or paternal allele. What happens if you go into your cell and check out a chromosome, and there is one paternal gene and one maternal gene. Okay, one paternal gene and one maternal gene, but in some few percent of your genes there is imprinting, that both maternal and paternal genes are not activated. At some places in your body, in some cells in your body, both the maternal and paternal are not activated. There is inactivation, that is imprinting of one gene, either maternal or paternal, and this is very much necessary. Okay, maternal imprinting refers to transcriptional silencing of the maternal allele. एक maternal allele होता है, एक paternal allele होता है बेटा. ठीक है, नॉर्मली तो दोनों एक्टिव होते हैं, लेकिन कुछ सेल्स में ऐसा होता है कि दोनों में से एक इनएक्टिवेटेड होता है, उसको इम्प्रिंटिंग कहते हैं. अगर मैटरनल की इम्प्रिंटिंग हो गई तो इसकी ट्रांसक्रिप्शन बंद हो जाएगी, साइलेंस हो जाएगी, और अगर पैटर्नल अलील की साइलेंसिंग हो गई, मैटरनल नॉर्मल रहा, तो इस पैटर्नल की जो ट्रांसक्रिप्शनल साइलेंसिंग हो जाएगी. ठीक है बेटा. ओके, एंड दिस अकर्स इन द ओवम आर द स्पर्म बिफोर फर्टिलाइजेशन, और ये फिर पूरी बॉडी में आगे ट्रांसमिट होता है. ओके, अगर ये जीनोमिक इम्प्रिंटिंग का फिनोमेना जहाँ होना चाहिए नॉर्मली ना हो सके, So it will lead to some disorders like Angelman syndrome, like Angelman syndrome, Prader-Willi syndrome, Prader-Willi syndrome. Okay. Genetic imprinting is the normal and very important phenomena, beta. This should happen. If it doesn't, it will lead to some disorders like Angelman syndrome and the Prader-Willi syndrome. Okay. Now let's come to some examples of the translocation. Okay. The translocation in case of the CML is very important translocation, beta. Chronic myeloid leukemia. It shows the translocation. What happens in this, beta? I can explain this much better from here. There is BCR-ABL gene fusion and leading to the formation of the Philadelphia chromosome. Can you see in this picture, beta? This is the chromosome number 9. This is chromosome number 9. And this is dark red portion. This is the ABL gene. This is the ABL gene, beta. And this is chromosome number 22 having this BCR gene. Can you see what changes occurred from going from here to here? That this portion of the ABL gene and ABL gene के नीचे जो red portion है, ABL gene which is dark red, and below this red this segment is just removed from here and added here just below the BCR. और जो यहाँ से segment remove हुआ वो जाके यहाँ पे fit हो गया. You can see the segment which removed from here got fitted here, and the segment which removed from here with the BCR with the ABL gene got fitted here just below the BCR gene. This BCR-ABL gene fusion occurs then, and this is called Philadelphia chromosome. Okay, this is the reciprocal translocation because both the chromosomes are sharing the segment. Okay, and then after this is the translocation in the Burkitt lymphoma. Okay, and I can also explain this Burkitt lymphoma translocation. This is also a reciprocal translocation. Very good example of the reciprocal translocation, the Burkitt lymphoma. You can see beta. Normally this is chromosome number 8 which is having this nice little MYC gene, and this is chromosome number 14 which is having this IG gene which is very much active portion. What happens in case of Burkitt lymphoma, that this MYC gene which is little blackish, this blackish MYC gene and this segment of the chromosome which is red in color, this MYC gene and this segment of the chromosome, they are removed from here and fitted here just below the IG gene. Okay, and this green segment which was initially present below the IG gene, it is removed from here and then fitted here. You can see this blackish MYC gene and this red part is removed from here and it is fitted here. Okay, you can see, and जो green part यहाँ पे मौजूद था बेटा वो यहाँ से निकल के यहाँ पे fit हो गया. Okay, this is the Burkitt lymphoma. Yeah, this is the chromosomal translocation. This is the reciprocal translocation which occurred in Burkitt lymphoma. Okay, a few last terms, beta, few words in the end of this lecture. That is the sex determination and the hermaphrodite and the concept of the pseudo hermaphrodite. Sex determination के बेटा different तरीके हैं. Genetic sex is determined by the presence or absence of a Y chromosome. No matter how many X chromosomes are present, a single Y chromosome dictates testicular development. Okay, leading to the male sex, and this is the genetic sex. इस तरीके दायरे बेटा आप ये देखो कि Y chromosome है नहीं है. अगर Y chromosome है तो it is male, अगर नहीं है तो it is female. Determining the sex in this way is called genetic sex. Okay, और गोनेडल सेक्स भी हो सकता है बेटा. आपके पास फर्ज करें कोई गोनेड है, आप इसकी हिस्टोलॉजी परफॉर्म करें और इसके अंदर आपको स्पर्मेटोसाइट मिलें, स्पर्मेटोसाइट, तो ऑब्वियसली इट इज़ मेल गोनेड. ओके, सो डिटरमाइनिंग द सेक्स दिस वे, दिस इज कॉल्ड गोनेडल सेक्स. एंड देयर कैन बी द डक्टल सेक्स. यू हैव ड्यूरिंग योर एम्ब्रियोलॉजिकल डेवलपमेंट द मुलेरियन डक्ट एंड द वॉल्फियन डक्ट. अगर इससे मेल डेरिवेटिव बने तो ऑब्वियसली फीमेल डेरिवेटिव बने तो इट इज़ ऑब्वियसली फीमेल, लाइक डेवलपिंग इनटू द फैलोपियन ट्यूब, यूट्रस एंड द upper part of the vagina. So this is obviously a female sex. So you can determine the sex from the chromosomes, from the gonads, from the embryological ducts, right? After this is beta last few terms, that is the hermaphrodite and the pseudo hermaphrodite. A true hermaphrodite implies the presence of the both ovarian and the testicular tissue. एक इंडिविजुअल के अंदर टेस्टिकुलर टिश्यू भी हो और ओवरीज भी मौजूद हो तो उसको हम क्या कहते हैं, ट्रू hermaphrodite. उसके कंपैरिजन में सूडो hermaphrodite ये होता है कि देयर इज डिसएग्रीमेंट. फॉर एग्जांपल, a female pseudo hermaphrodite has ovaries but the male external genitalia. अगर एक फ़र्ज़ करें ये एक इंडिविजुअल है, इसके अंदर जो गोनेट्स हैं वो ओवरीज हैं, लेकिन जो एक्सटर्नल जेनिटेलिया है वो क्या है, मेल एक्सटर्नल जेनिटेलिया, दैट इज प्रेजेंस ऑफ द पीनिस. ओके, so this is the female pseudo hermaphrodite. You understand? This is female pseudo hermaphrodite beta. And male pseudo hermaphrodite, when you have testicles, gonads are testicles but the genitals are of female type. I hope you are clear with all these terms beta, and you got the concepts. If you did, you can appreciate me by liking to the video and subscribing the channel. Thank you so much beta. Class dismissed.